So my name is Pham. I'm an assistant professor of neurology at the University of Maryland School of Medicine, and I work primarily out of the Stoller Cancer Center. So I did my medical training at the Virginia Tech School of Medicine in Roanoke, Virginia. Then I did my neurology residency at Baylor College of Medicine in Houston, Texas. I fell in love with neuro-oncology while I was there, and I subsequently did my neuro-oncology training at MD Anderson Cancer Center, also in Houston, Texas. So I specialize in neuro-oncology, which is the treatment of primary brain cancers. Along with my practice treating patients with primary brain cancers, I also treat patients with neurologic complications of cancers. And that can include anything from neurologic complications from chemotherapy or just side effects of having metastatic disease to the brain. The kind of conditions and treatment that I focus on the most are primary brain cancers. So these are cancers that starts in the brain, then usually stays in the brain. So that includes anything from gliomas, both low-grade and high-grade gliomas, to meningiomas and ependymomas. All of these are what we would call primary brain malignancies. So that's what I generally focus on. So my approach to patient care is really patient focused. That's what I really hope to do. I think one of the really tough thing about neuro-oncology is that it really does strip away at the patient's sense of self. So my approach starts with getting to know the patient, what is important to them, and really trying to understand how I can still support them, their individuality, their goals, their values as I take them through their diagnosis, their treatment, and then the subsequent associations that come with treating cancer of the brain. And so for me, I take a great pride in getting to know my patients personally. And so I try to get to know them and their family members, and that help guide our process as we go through both the diagnosis, talking about the prognosis, what comes with treatment, and then choosing the right treatment for my patients as well. So neuro-oncology itself is a multidisciplinary specialty. So first, it comes with being able to diagnose what the patient has. And so usually that involves working closely with our colleagues in neurosurgery. Then subsequently, once we have a diagnosis, then we have to figure out what's best for the patient, whether it's radiation oncology or chemotherapy or the combination. For me, I'm primarily responsible for the patient's chemotherapy as well as any of the treatment of the neurologic side effects that comes with having cancer in the brain, whether it's seizures, whether it's fatigue, it's swelling, headaches, things like that. People always tell me that when they think about neuro-oncology or brain cancer, it makes them sad. It feels like there's not a lot of hope. But in my mind, I actually think it's the part of neurology and part of oncology that still has a lot of potential. I just don't think we're quite where we want to be in terms of being able to take care of the diagnoses that we deal with. And I think there's a lot of potential there. The science is evolving to a point where we are slowly starting to understand what it means at a very biologic and molecular level to have some of the primary brain diagnoses that we have, such as glioblastoma. And I think there's a lot of science and evolution that's going to happen within the next couple of decades. And so, here we're trying to do that by engaging in clinical trials and developing trials so that we can create these new treatments for our patients. So there is hope. From a very young age, my parents always tell the story that I've always wanted to be a doctor ever since I was about 3 years old, and I always told her that I was going to be a doctor. I think part of that was because my mom was quite sick when I was growing up, and I told her I wanted to help make her feel better. And then I guess that just continued, and that was my dream as I went through elementary and middle and high school. And as I discovered more about what I liked in college, which was really just the study of the brain, neuroscience was my specialty or my major in college, I really knew that I wanted to focus on the brain as I continued on with my professional training in medicine. What I enjoy most about caring for patients is really just being able to really make that very human connection with someone. For me, it's really changed my own personal values and how I approach life. One of the benefits, if anything, with treating patients with neuro-oncology, if there is really any benefits, is that you meet patients at a point in time in which they are very vulnerable. And for me, it really helps me understand the humanity of what it is that we do in medicine. And it goes just beyond the diagnosis, beyond the treatment, but really helping someone navigate a very challenging part of their life and to be able to discover and reorient themselves and figure out what's really most important in life. Oh, what do I want patients to know outside of my medical interest? I keep myself as a pretty open book. My patients know this. I am a totally open book. So, um, I have two kids, and they are my pride and joy. And my two sons keep me on my toes. And I think part of that is that I'm so inspired by my patients and their just will to fight and to live life to just its fullest every day, knowing what the difficulty that they go through. So for me, I spend outside of my time in medicine, I spend all of my time with my family. And right now I have a 6 and a 2-year-old. So most of the time we spend our time trying to keep the roof on the house. And right now it's there, we're mostly just trying to expend their energy with every ounce of energy that I have left at the end of the day. We spend a lot of time outside. We're about to take them snowboarding. Go biking. For me, it's all about family.